Okay, my name is Dan Salinas and this is my eye exam video. So we're going to begin with just appropriate palpations of the face. So we're going to start with the bony structures of the orbit. So we're going to start with palpating the frontal bone here. We're going across, down to the zygomatic bone, across to the nasal bones here in the front, and then the maxillary bones here. So we're just looking for any fractures, discoloration, deformities, swelling, anything like that with those. Along with those, next, we'll do doing the inspection of the eye, just the general external features of it, from what we can see without the ophthalmoscope. So we're going to look at the general globe of the eye. That's just the whole thing. We're going to look at the sclera, which is the white part on the outside, looking for any lacerations or any abrasions like that, any blood. We'll be looking just at the iris to see if everything's okay. We'll be looking at the pupil, see if there's any kind of blood in the chambers for hyphema. Any teardrop will indicate there's a laceration on the cornea. I think that's all we're looking for. You can be looking for bacterial infections, so at the cornea, the conjunctiva, if they have a stye, or even around the eyelid. You can just look for pink eye as well. So with that, that's our general inspection. We'll be going into pupillary response test. So you can have a look at me. We're going to be using a pen light to get the pupil to contract and dilate appropriately. So you're going to be covering one eye, you're going to be doing both. So you're going to have them look at the tip of my nose. Cover one eye, you're going to go just a quick 1 second, watch the pupil constrict, good. Switch, watch the pupil constrict on this side. Good, they're equal, so you look for pearl, pupils equal and reactive to light, and they look like they're good. Next we'll be doing eye tracking, so using the pen light, I'm going to have you stare at the tip of this pen, and you're going to follow this going this direction, going down, that way, and diagonal. Good, and you're just looking for any kind of lagging at all, so making sure that they're equal, essentially any abnormalities with that. Could be injury to their muscles or any kind of nerve injury as well. So we'll be going into the ophthalmoscope now. So we'll be doing this device here. So first off, you're going to set it to appropriate setting for your eye particularly. So there's a black and a red number. Black is for examining more external features. So we'll get that one first off. So you do about, look into it with the light on. You're going to go about 3 inches away from your face and kind of try to focus on something and adjust the numbers appropriately to where it is a good number, good focus for you. So mine is about a 6, and that looks good. So my black number is 6. Next, you're just going to focus on something in the distance. You're going to do going into the red numbers. So you're just going to kind of focus, and you're going to adjust the numbers appropriately to it is very, very clear for you. Mine is about 1, -1. Will be red 1 or 0. I'll kind of bounce between the two. So after you have that set, we're going to be having them look forward, actually just over my left ear for me, please. You're going to place your right hand on their forehead just to make sure you're going to be get very close with this. So we're going to set it to black 6 to look at the external features. So I'm going to go in, you're going to get very close. You're just going to be looking at the pupil, iris, sclera. You can even pull up the eyelid just a little bit. Everything looks fine. Everything looks good. Good. So again, as I said, like in general inspection, you're going to be looking for any lacerations, abrasions, any blood, teardrop deformities, stuff like that. So now we're going to go to looking inside the eye. You're going to be looking through the pupil, past the lens. You're going to be looking at the, looking for like the optic nerve and the fovea centralis. Also looking for any abnormality to see if the retina is detached from it at all. You're going to look at the retina, making sure that it's good to go, nice and normal, I guess. So we'll just go with that. So if you can sit there, hand placement on the forehead again. You're going to Look into the eye. You're gonna look in the back and you can start seeing some veins and blood vessels. You're gonna kind of look directly in the back where a dark area will be your foveus centralis, it's the area for best acuity. And then you look in the very back in the center, looking for your optic nerve. This would be their blind spot. But that's normal because there's no rods and cones there. That's basically general inspection of the eye. So there you go. We'll be doing our Snell chart in just a moment. Okay, cool. Okay, so this is the last part of the eye exam. This is Snell chart. So what we have here is the Snell chart. This is a printout version set up at 10 feet. The standard is 20 feet, but we're working with what we got. But that would be ideal is to have 20 feet. So I'm going to have Kevin read these down from top to bottom. I'm going to have him cover one of his eyes. Also to note that he has glasses on. So he has glasses on, so make sure that he just goes through it with that, and I'll take a note of that on any of that. So cover your left eye. Perfect. So now I'm going to have you go down. So read here, first line.
CS.
Okay. Second line.
DVOH.
Good. Next line here.
OHVCK.
Good. Next one here.
HZCKO.
Next one here.
NCKHD.
Right here.
DHOSZ.
Good. Next one.
VRNDO.
Next one down.
CZHKS.
And the last one.
ORZSK.
Great. So with this 10-foot online printed chart, it only goes down to 20/20 vision. That's where he got. He did not miss one single thing. You're allowed to miss one letter and still pass. If you hit 2, you will consider that a fail with that one. So what the numbers mean, 20/20 means he's at 20 feet, he sees what most people see at 20. If he was at something like this third line here, 20/80, at 20 feet, he would be able to see what most people can see at 80 feet. Yeah, that's it. That's the Snell chart, that's the Snell exam and how you do it, and that's it. There you go.